Crohn's disease is one of two major types of inflammatory bowel disease. It was named after some really smart guy who lived a long time ago, but I can't remember his name. Any person at any age can develop Crohn's disease, but it is rare in young children. Nobody knows what causes Crohn's disease, but it seems to be an overreaction of the immune system in response to some environmental trigger, perhaps some sort of bacteria or virus. There are genes associated with an increased risk of developing Crohn's disease, but no one gene causes the disease. So what are the symptoms of Crohn's disease? Let's give Michael here the disease and find out. So, Michael, how are you feeling? Not so good? Let's see. You seem to have weight loss, diarrhea with blood, crampy abdominal pain, fever, and loss of appetite. Unlike an infection, the symptoms can last for several months or longer. You better see a doctor. Crohn's disease can cause inflammation and ulcers anywhere in the gastrointestinal tract, from the mouth to the anus. It sounds like it's time for Michael to have a colonoscopy. Yep, just as I suspected, ulcers in the colon. Crohn's disease can sometimes cause inflammation or an infection that spreads outside of the intestines called an abscess. We better do a CT scan on Michael to find out. In severe cases, poop can actually leak to the surface of the skin, and that's pretty gross. There is no one good blood test for Crohn's disease, but we better take a small blood sample from Michael here to check. A high white blood cell count or a low red blood cell count are common. Okay, it is time to give Michael here a break. There is no known cure for Crohn's disease, but treatment is pretty good. Antibiotics and anti-inflammatory medications can control most of the symptoms. Occasionally, surgery is required to remove an infected segment of intestines. Okay, Michael, feeling better? Yes? As you know, people with Crohn's disease can still live a normal life but require medications to control their symptoms. The disease likes to flare up occasionally, and this may require extra visits to the doctor. So off you go, Michael. Thanks for all your assistance.
So in this video, we're going to look at IBD, which is inflammatory bowel disease. A chronic inflammatory bowel disease which pursue a protracted, relapsing, and remitting course. There are two types of IBDs, and let us look at them now. So IBD typically involve the colon, but of course, one of the types of IBD involve the whole GIT. Now, the two types of IBD are ulcerative colitis and Crohn's disease. When talking about ulcerative colitis, it mainly presents with inflammation of the rectal and sigmoid colon, about 40 to 50%. And this is referred to as proctitis. Now, comparing that to Crohn's disease, in Crohn's disease, the main area affected is the cecum and the ileum, the ileocecal area. 40% of Crohn's cases involve the ileal and ileocolonic area. The second most common area affecting Crohn's is the small intestine, about 30 to 40% of cases. And in the small intestine, we see the inflammation in segments. This is termed skip lesions, because you have inflammation, and then you have no inflammation, and then you have inflammation again, and then no inflammation, etc. Some people who have Crohn's can have skip lesions in the colon, the large intestine. 20% of Crohn's disease cases have this, and this is referred to as Crohn's colitis. And finally, a small majority of cases have perianal inflammation. So those were the four most common areas affected in Crohn's disease. And as we have learned, a typical characteristic of Crohn's disease are the skip lesions. Going back to ulcerative colitis, the main areas affected, as we talked about, is the rectal sigmoid area, and this is termed proctitis. Well, a characteristic of ulcerative colitis is that the inflammation can spread, and it spreads proximally. So from the rectal sigmoid area up the descending colon. 30 to 40% of ulcerative colitis cases have this, and this is termed left-sided colitis. If the inflammation spread far enough that it reaches the transverse colon, this is known as extensive colitis. So we just saw the common areas affected in ulcerative colitis and Crohn's disease. And we saw that they had some differences in that ulcerative colitis spreads distal to proximal, and Crohn's disease have skip lesions and mainly affects the ileocecal area. But there are a lot more differences which we will go over later on. But first, let us look at the signs and symptoms associated with the inflammatory bowel disease. So signs and symptoms of inflammatory bowel disease can include, but not always, diarrhea, rectal bleeding, abdominal pain, tenesmus, fever, weight loss, vomiting, cramps, and muscle spasms. Let us look more at the differences now and similarities between the two types of inflammatory bowel disease. So we will look at the differences in gender, incidence, smoking association, the onset, location, pathology, histological differences, as well as complications. So in ulcerative colitis, both genders are affected in the same ratio, whereas in Crohn's, they affect more female than male. Incidence of ulcerative colitis and Crohn's disease are similar, except there are more cases of Crohn's disease diagnosed per year, 2.1 to 20 per 100,000. Smoking is very interesting for inflammatory bowel disease because for ulcerative colitis, smoking is actually a protective factor, whereas if you smoke in Crohn's, this actually aggravates the condition. The onset of ulcerative colitis and Crohn's are roughly the same. The location which we talked about earlier for ulcerative colitis is mainly the distal colon, the rectum and sigmoid area, remember? And for Crohn's, it's the distal ileum and cecum, but it can also affect other areas along the GIT. Now let's talk about the pathology, the differences. So for ulcerative colitis, it is a continuous inflammatory lesion that basically progresses from the distal colon to the proximal colon. Now, whereas in Crohn's, it is typically discontinuous, patchy, gut inflammation with skip lesions. Histologically, ulcerative colitis is a superficial inflammation, whereas Crohn's disease is a transmural inflammation, which means that it actually goes through all the layers of the colon. Complications of ulcerative colitis include severe bleeding, toxic megacolon, rupture of bowel, as well as colon cancer. For Crohn's disease, complications is more severe because histologically it affects all the layers of the GIT, transmural inflammation. So therefore, complications include stenosis, abscess formation, fistula, colon cancer, as well as perforation. Okay, now let's put all this into drawing. Let us first zoom into the ulcerative colitis affected colon here. So here is the inflammation of the large intestine, the superficial inflammation, remember. Ulcerative colitis, it changes as in relapsing and remitting. When the disease is active, it causes ulceration and inflammation. When inactive, the cells are basically dying. You get atrophy of cells following the inflammatory reaction. In ulcerative colitis, you can get complications such as severe bleeding, toxic megacolon, rupture of the bowel, and colon cancer. Now, if we were to take a section of the large intestine, we have the histological layers, of course, the muscularis, the submucosa, the mucosa, and you can also have these things called pseudopolyps, which is a characteristic feature of ulcerative colitis. Pseudopolyps arise because the cells of the colon are trying to regenerate, but they regenerate weirdly, causing these polyps as a result. Now let us compare ulcerative colitis to Crohn's disease. In Crohn's disease, it can affect the large intestine or the small intestine. Let us zoom into the small intestine. So here within the small intestine, you see transmural inflammation with skip lesions. Complications of Crohn's disease include stenosis, abscess formation, fistula, colon cancer, as well as granulomas. If we were to take a cross-section of the small intestine, here is the mesentery, the muscularis, the submucosa, and the mucosa. We can see in Crohn's disease, all the layers are affected. It is a transmural inflammation, and so complications of Crohn's disease can be quite serious in that it can lead to perforation, fistula, etc. And in the next video, we will look more actually at the pathophysiology of inflammatory bowel disease, as well as look at the complications, the local as well as systemic, and the investigations and management that is performed.